appears. It was good. I think there has been some significant improvement in how videos appear. So you can join in the conversation and enjoy the video. Remove the retouch. Welcome to the live. Remember to double tap on your screen as you come in. Thank you for joining in. We are live. Thank you for joining in. Welcome, welcome, welcome. Who is first to join? Let me know in the chat. Where are you watching from? Sometimes people just pop in, pop out. And that's the way it is sometimes when people come visiting the hospital, pop in and pop out. But I want you to come in and settle for this session. It promises to be engaging and interesting. How are you doing? I believe I'm audible. Let me know in the chat if you can hear me. So as much as possible, I try to do the ensure that the audio is good. So let me know if you can hear me. Welcome, welcome, welcome. Okay, welcome everyone. Thank you for joining in. How are you doing? DN says, yo man. Thank you for joining in. Let me know where you are joining from. And you can kindly double tap on your screen to like the live. I'm glad that you are here. It's so good to know that quite a number of people are watching at this time. DN, first to drop a comment. Please, may I know where you are watching from? All right, so here you haven't seen my face. You can see me now. I believe you can see and hear me clearly. Welcome, DN. If you are joining in, kindly drop in the chat where you are joining from. Where are you watching from? I'd like to meet you. And how are you doing? Welcome to this live. So sometimes there's a whole lot to say, but we have to just try to define and talk about the things that are important to us per time, and we need to prioritize those things and be sure that we are addressing them appropriately. So on that note, I want to welcome you to this live. May I know where you are watching from? Please let me know if you can hear me clearly. Am I audible? I believe I'm audible, right? You can give this live a thumbs up. Let me know if you can hear me clearly. So how are you doing? Where are you joining from? I'm happy to have you here. It's good to have you here. Thank you. Thank you. Thank you, DN. I'm waiting for identification. Let's know who is here and where you're watching from. Yes. Thank you for the like. Kindly. It's well appreciated. I believe more people are joining in. So let's get into the conversation.
What is the time?
It's 8:45 p.m.
8:45.
Yes, it's fine.
I'm on the
We are
job.
live. Okay. Just give me some minutes.
Okay. I ate too much today.
I'm live. Okay. What did you eat? You ate a lot of things. Okay. Just a minute. So you are feeling full. You want to take more water. Subscribe now. Okay. Welcome to the live. Thank you for joining in. Please let me know where you are watching from. Thank you for the like and the support. So thank you for joining. Where are you watching from? I dropped a poll. Kindly respond to the poll. Give your support. DN, are you still there? Okay, we need to make this more interactive. Welcome back. Where are you watching from? Popping in and popping out. That's likely to be. They say that's likely to be a Nigerian. Okay. If it's not in Nigeria, let me know who it is. So one of the things that we must learn to do is to be bold, bold about the things that we know are right, things that are true. We should be bold. We should be able to uh, speak up where we need to speak up. We should be able to engage in conversations where we need to engage in conversations. Nobody actually knows what's on your mind until you have spoken. All right. So it's very important to keep this in mind. It's actually a healthy way to live, living without consciousness of the need to communicate. Communication is very important, you know, and very crucial for our even relating to our health. Okay, I said I'm going to be sharing some things with you, something with you. Okay, it's important to note that there are many reasons why people visit the hospital. Okay, I don't know if you have ever visited a hospital. I don't know if maybe you are a medical practitioner yourself. Of course, you have to you have a choice than to if you practice clinical medicine, you consult in a clinic, you operate as a surgeon, depending whatever your specialty is, you have to be in an office in a consulting room where you have to attend to patients. Okay, but there are many reasons why people actually uh, present to the hospital. Okay, some of those reasons will be we actually amaze you. Okay, but to me, as a medical practitioner, I don't see any anything wrong for whatever reason, once it's a positive reason, why an individual is presenting to the hospital. Okay, Some people actually come in for normal checkup, you know, just routine check for doctor to engage them, ask questions relating to their health, of course, social life, family life, any previous history of surgery, and other related questions. Okay. However, it is important to note that, okay, in the course of that, there may also be a need to have a clinical examination, and then results investigations are requested for people that come in. Some people actually come in with results. Okay, that's another reason why people come to the hospital. Some people already have, especially in on this side of the world, in this side of the world, in this part of the world, there is that consciousness of individuals, or maybe following recommendations from professional or even non-professionals to run one test or the other. So some people just come to the hospital to present such results or reports of investigations, and they want the doctor to go through, analyze, and tell them about the results. Okay. Sometimes, interestingly, some people would have spent money doing. Sometimes those tests are necessary. Oftentimes, some are not necessary, or probably done in places where there may be doubts about the results. Okay, so they may eventually have to spend more, having to run those kind of tests again. So it's important to uh, keep this in mind, of course, as a medical practitioner, or if you're a doctor watching, or even if you are a patient, or you have a relative, a friend, anyone that you are supporting, um, requiring health services. All right. So, have you ever had a checkup? Have you ever visited the hospital? And if you have, what, for what reasons? For what reasons? Okay, so we're still talking about reasons why people have pay visits to the hospital. I've talked about the fact that there are some people that they just have to be there for the sake of work as medical practitioners, as part of the health team. All right, pharmacists, nurses, physiotherapists, even security officers who work within the hospital setting or setup. So these are people that we have to visit regularly, and that's because of work requirements. Okay, but there are people who just pop in and pop out. Okay, so some people pop in on the general note of requesting for a review of their medical tests. So they want a doctor to analyze the results for them. All right. Sometimes it's test may probably have been requested by another doctor. Some other times, usually done on a personal note. Okay, maybe because of one symptom or the other that they have noticed. So if they are able to come up maybe from Google, or maybe from the experience another person has had, then they tend to go for similar tests and then present at the hospital. Okay, for the kind of practice, the place where we practice, there are certain results that will come from certain places that we may not even know, but looking at the results, the pattern, and sometimes the discrepancy when you look at the person clinically, and the results being presented, sometimes it could be contradictory. So such individuals sometimes are requested to run those tests again. They are requested to run those tests again in reputable uh, settings where such results can be trusted. All right, so because there are all kinds of centers, all kinds different equipment, people not having standardized ways of measuring and bringing out results, and there could also be human error when interpreting results. Okay, so these are some of the reasons why some people may need to have repeat of any test or investigations they are presented with. All right. So other reasons, major, because of the consciousness that people now have about their health, people tend to present for checkup, especially once you're above age of 40, you should have some routine investigations as a man, routine checkup, even if it's just once in a year. Okay, and then for the female too, for the woman, there are all certain tests that will be beneficial as normal checkup. So I did a video on health screening for women. You can check out that video and the list of long videos under videos on the channel. So I'm sure you will find this interesting. There's certain general tests that should be done on a yearly basis. You don't have to wait till you have symptom. You don't have to wait till you begin to experience pain. And by the way, pain is not actually a diagnosis. Pain is a symptom, and usually a symptom of certain conditions. So it's like a message coming through your body to say there's something wrong somewhere. And most of the time, people tend to deal with the symptom, that's the pain, rather than uh, checking and looking for the cause. So what your doctor does really is to consider the symptoms, the complaints, look at social history, family history, uh, previous medical history, previous surgical history, and then determine if such an individual now needs to run certain investigations considering a diagnosis or differential diagnosis. Differential diagnosis means that considering different conditions that may cause certain uh, symptoms. For example, if a man is urinating frequently, it may be related to one, two, or three things. Maybe urinary tract infection. It may be related to prostate enlargement. It may be related to diabetes. Okay, so we're not just going to be treating the pain. We're going to be identifying the underlying condition. Of course, we treat the pain, but we need to identify the underlying condition and manage appropriately. Okay, let me know if you can still hear me. There will be some background noise now. But let me know if you can hear me. I would like to know in the chat. Thank you for the second like. Thank you so much for engaging. Welcome to the live. If you're just joining in, or if you are just coming across the channel for the first time, we do a lot of talks on health, wellness, and lifestyle. We talk about sexual health, mental health, chronic medical disorders, everything around health, exercising, diet, weight loss, you know, anything, just mention it. All right. So, by the way, I'm a family physician, I'm a medical doctor with special interest in reproductive health, mental health, and of course, management of chronic medical disorders. All right. So, I was talking about reasons why people present to the hospital. So, I'm sharing some of these things with you. In fact, you may have presented to the hospital for one or two of these reasons. All right, so I've mentioned two. Now, another one is what I was talking about before I went offline. That is pain. Pain, which I already said is a symptom and not a diagnosis in itself. All right, so when somebody has pain in the head, they say the person has a headache, pain in the abdomen, abdominal pain, pain in the bone pain. Okay, these are different types of pain. So sometimes people actually have done a lot trying to deal with the pain, pain in any part of the body, and then having noticed maybe it's an increasing severity in the pain is now getting much, they begin to consider seeing a doctor. So that's another reason why people come to the hospital. So some of these things are interesting, all right. Interesting in the sense that as a doctor, we come across a number of different cases, different personalities, different ways that people present to the hospital. All right. Interestingly, sometimes we talk about different manners, different experiences in terms of treatment that must have been received prior to coming to the hospital. All right. So pain, it may be acute pain. For example, somebody has a sudden sharp pain in the abdomen. It could mean a number of things. It could be typhoid perforation. It could be acute appendicitis. So until the individual presents to the hospital for proper questioning, history taking, examination, and relevant investigations before some diagnosis can be made. All right. So pain is one major reason why people present to the hospital. All right. And if you have ever felt pain, uh, even if it was just a tooth pain, you know what it means, and you know how you couldn't bear it. I remember decades ago, you know, when I had to visit the dentist, I had to then, tell my parents that no, I needed to see dentist. The pain was very unbearable. Have you ever had a tooth pain before? All right. So sometimes pain forces people to get to the hospital. All right. Okay. Another thing is, apart from pain, now I will use fear. Even though fear keeps people may keep some people away from the hospital. Fear of the fact that they don't know what diagnosis can be made, and they don't want to know because it could be scary. All right. And then for some other people, fear actually brings them to the hospital. Fear of the unknown, fear of the pain, not sure what it means, and different interpretations, especially after using Google or any other search engine to check symptoms and diagnosis. All right. So all kinds of diagnosis come up when it comes to pain, and Google will help you to increase in the fear that you already have if you are not careful. So I have sometimes come across individuals or patients who are coming to say, "Oh, I'm here, doctor. In fact, I don't know what's happening to me. My mind has gone far, thinking about so many things." So it's always a good thing. It's a good step to want to clarify why you're having a particular symptom, and having tried your own way, in this age of artificial intelligence. Uh, a number of tools are available to even guess your diagnosis or make a diagnosis. All right, so I'm checking the chat. You can drop a message. Let me know, uh, those who are in. If you are here, I know quite a number of people are watching. So let me know as you are joining in where you are watching from. What time is it in your location? I'm happy. I'm happy. I'm glad. I'm grateful that you are joining this live. All right. For those that will be watching later, the opportunity to access it on the channel. All right. So thank you for the third like. Well appreciated. Thank you. Thank you so much. So we are still talking about why people uh, pay visits or visit the hospital. Okay, I've shared that, and I was talking about fear. Okay, so sometimes when people eventually come, uh, often than not, sometimes there's really no deadly situation, especially where pain has been. All right, except it's an acute pain that has a clear diagnosis. But sometimes what people must have thought is not, sometimes it's not there. All right, so it's always good to come for that checkup, for that clarification. Some people have had their mind messed up because of that fear of a diagnosis that had not been proven. All right, so that in itself could even harm the individual mentally. Okay, and then um, when they present, it's something that can be sorted. Now, there are others who present because somebody forced them to come. And that one is interesting. Okay, it may be a child of a parent or some of parents, or a particular parent, or a relative, a family member, or a friend, okay, that has encouraged or even brought um, his or her relative to be seen by a doctor. Some of these people are people with chronic conditions, actually, that probably must have been ignored, or out of because of fear, have been kept away from the hospital. All right, so some people eventually present to the doctor because someone eventually can help them to take that bold decision to present in the hospital. That's one other reason why people come to the hospital. Another reason is accompaniment. Accompaniment. So when someone is just accompanying another, it may be a husband accompanying his wife, or a mother accompanying her son. So sometimes some of these people look out for opportunity, this kind of opportunity to also be attended to. They will have a proper checkup, or they may begin to request for a free consultation with the doctor. Okay, so these are some of the things that happen when it comes to uh, presenting for treatment in the hospital. Let me know your thoughts Have you ever presented to the hospital? And if you have, what was the reason, and how how did you feel at that time? And what do you think about the different ways, the different reasons why people present to the hospital? Kindly share your experience. I'll be waiting to see your comments, your chats. Remember the poll, kindly support, kindly subscribe. If you are yet to subscribe to the channel, then you can also click on the like to like this live. And you know, so many people in the community are waiting to welcome you. If you are yet to subscribe, you can subscribe now and get to be a member of the community. It's a growing community. I'll be glad to have you join us. So welcome once again. So let me know in the chat what you think. Why do people come to the hospital, and what do you think about that particular reason? You know, I talk about someone accompanying another and eventually trying to seek for medical attention. Okay, not because they came by themselves, but because they had someone who was being seen by a doctor, and then they felt they could take that opportunity to also be seen by a doctor. What do you think about this? As a doctor yourself, what do you think? And as a patient, or as a yes patient, or an outsider, what do you think about such um, approach, such an approach? Thank you for staying tuned. Okay, still waiting for some people that will be joining towards the end of the live. All right, I know there have been some coming in, going out, coming in, going out, coming in, going out. All right, so I know people have different things that they're doing at this time. All right, thank you. Thank you for the fourth like. Have you been following? Let me know in the chat. I've been talking about reasons why people visit the hospital. I started by saying that it's important to learn what is right, to know what is true, and then do what is right and true. And we should be bold about what we know, and what we should be doing, and doing them. So what was the reason, or what are the reasons you visit the hospital? What are the reasons? Okay. Thank you so much for the fourth like. It is well appreciated. Thank you so much for the likes. Do you have any question, any area of interest? By the way, watch out for videos. New videos will be coming up soon. But if you are watching or coming across my channel for the first time, remember to subscribe so that you can get even notifications. Remember to click on the notification bell and check for all notifications so that you can be notified as soon as I come up with a video, a short, or even a post in the community. Content creation is not for the weak. YouTube is not for the faint-hearted. It's work. And the passion must be there. Very important. What keeps you going.